I'm fired up and I'm ready to go. I'm fired up and I'm ready to go. I'm fired up and I'm ready to go. This is the Billionaire Brown experience. Let's go.
Healthcare package based off of what you know and the knowledge that you've accumulated over the years. You said you would definitely include hospital, and you would definitely include prescriptions.
Yes.
What should we know about prescriptions in healthcare? Is there anything you can teach us or enlighten us with as far as prescriptions in healthcare?
Prescriptions for, the cost of prescriptions make no sense. I mean, you see some prescriptions are $2-3, and then there's some prescriptions that are $10,000 a month, and that's why your health insurance has to cover prescriptions because of some sort. Because if you end up in that situation where you end up on one of those crazy medications, you're stuck. And discount plans are great for them, but $10,000 medication with a discount plan might become $8,000. On some of those high end things, and that's the problem. Sadly, the cost of drugs in this country is astronomical. I mean, prescription drugs, that is, and on certain ones, and I don't understand. I mean, I understand research and development and those kind of things, but I mean, you get them in other countries for a lot less. I mean, there's oftentimes I have a vendor of mine who works for the International Pharmacy, and he has found medications like the EpiPen, for example. The EpiPen, remember the big thing maybe a year ago where they raised the price from $299 to $699. Well, my guy at the International Pharmacy was able to find them in London for $200. Back like the old price. Yes, that's a scour of the world to do it, but I mean, why is the same stuff you get for $200 there and not here? It's probably made here, shipped over there, and sent back. I have a lot of my clients get stuff out of Canada. Canadian drugs most of the time are about a third of the price they are here, and I know I have one client where I had to do the research for him, and the medications were made at Abbott Labs in Columbus, Ohio. Yet I can get for a third of the price up in Canada. I don't understand. So I mean that's one of those things there where. And that's one thing that Trump said he wanted to do when he was campaigning was to bring pharmaceutical companies in from overseas to compete with our prices. And that, my friend, would bring costs down tremendously because people are already shopping over there. Bring it in here, and then make it easier for everybody to get their hands on. And I think that $699 EpiPen goes away, in my opinion.
Okay, so again, we're here with Eric Wilson, ISellHealth.com. And Eric, I wanted to also ask you about, so I used to be a loan officer. And one of the things that I seen before this real estate bubble happened, almost a decade ago now, there was these loans. A lot of people, they didn't care about what the loan was. They just wanted the lowest payment. That's all they wanted. They didn't, and I would try to tell them, right? I'd say, listen, this is some of those loans that I was giving out wouldn't even, when they made their monthly payment, it didn't even touch the principal.
Right.
So my question, but they wanted it and they needed to have it, and you can't force people to get something that they don't want.
Right.
So, and bringing it back to healthcare, like, are there things like that in healthcare that people are overlooking, or that you would like? I don't know how to ask the question, but I'm trying to find is there like some common things that people consistently bump their head against, even though you tell them otherwise?
Well, yeah. There's a lot of that there with healthcare because now the insurance companies have smaller networks of doctors, so that where some doctors don't participate in all plans now. So you may have a doctor that you want to see, and he doesn't accept your plan. So you have to really look at the network, look at the doctors. You have to look at people get caught up on the deductible too much. You have to look at what's your overall out of pocket maximum. But the biggest thing is, if there's a doctor or hospital that you really want to see, you have to find out if you can do that, with that plan. Now, like in my market in Chicago, where I am, on the individual market, Northwestern which is like one of the better teaching hospitals out here, no longer accepts any Affordable Care Act plans, any of them. They'll still deal with all the Blue Cross for the group health. The Blue Cross on the individual market, they will not accept. So, if you want to go to Northwestern on the individual market, you cannot. I mean, it's just not possible. So that's something you have to look at, on plans like that. I had a client the other day. He was like, "Well, I want to go to Northwestern," and I was like, "Oh." He didn't really believe me. I was like, "Look, let's look at every company." We went through the few companies that are there in the market. We checked online. I had shown them a web conference as to these are the doctors, these are the hospitals, these are all the hospitals within a 30-mile radius of your house. Do you see that hospital there? No. Next company? No. And that's how I had to prove it to them. So the big things with healthcare are, like you said, the cheapest plan, like you said, is not necessarily the best plan.
Okay. All right, and what would you? Let me see. Oh, you talked about a little bit about annual maximums, and also looking at, don't throw all your eggs and your attention into the deductible. The deductible, sounds like what you're saying, it's important, but it's not everything. So right. The punchline to my question is, if before you sign and get a healthcare policy, whether you get it from iSellHealth.com or you get it from another agent, right, or another broker, what would you say are some of the important things we need to look at before we go through with a policy?
Right. Okay. All right. The first thing I would look at is your out-of-pocket maximum. That's the big one. Well, there's a lot of plans you'll see a low deductible, but the out-of-pocket maximum is the same as a cheaper product. So, and I go back to, if I have the big one, what's it going to cost me? It's just a matter, if I have to pay the first $5,000, or if I, and there's a $10,000 out-of-pocket maximum, if I got to pay the first $10,000, at the end of the day, it doesn't matter. If I have the big one, it's going to cost me the same either way. So the out-of-pocket maximum is first and foremost. Then the second one would be, doctors and hospitals, especially in my proximity. If you have to go to the hospital, you don't want to have to go 60 miles to the hospital. So, obviously, usually an emergency situation is covered regardless, but, if you need knee surgery even, where you can schedule that, you still don't want to go 60 miles to the hospital. They have to like it for rehab or follow-up visits and whatnot. So very important to find out, that the hospital is somewhere near you, within, depending upon your market, 10 miles, 8 miles. If you live in a big city like Chicago, 10 miles is a long way because it takes you 30 minutes to go 10 miles, in the city. So, you need about 2 or 3 blocks there. So, they're probably the two biggest things. And then I guess the third thing would be, reputation of the company. Because, we saw a lot of companies in the last couple of years go out of business. And, you don't want to be...
Why did most of them, when you talk about reputation, why were a lot of these companies going out of business?
Well, when the Affordable Care Act passed, they started these things called co-ops, which were basically not-for-profit companies designed to compete with the for-profit companies under the law. 26 of them were established throughout the country. 19 of them went out of business. Mostly because they underpriced themselves. They underpriced, they're trying to get markets there. They underpriced themselves and then became insolvent. And they also took on a sicker population. So that was probably the biggest reason.
Wow. Okay.
But I even look at like Medicare. When we look at like a Medicare company, for those over 65, looking for a Medicare supplement, you'll see, usually you look at how many years have they been in the market. they may have been like Cigna, for example. Cigna is a good company. They've been in business a long time, but they've only been in certain markets for a couple of years in the Medicare field. So you see when a company's only been in the market for a short time, you tend to get a bigger rate increase when the claims start falling in.
Okay. And what would you say is the major difference between insurance and discount plans?
Okay. The big thing with insurance is with insurance, there is typically always a stop loss, meaning a maximum that you're going to get, the maximum you're going to pay for a claim. So I go back to like my plan with a $6,000 100% coverage, or there's a lot of plans now that are $7,500 maximum out of pocket. If you have that brain surgery, God forbid, that's what's going to, you know that $7,500, and then it's basically a blank check there. It's 100% coverage thereafter. With a discount plan, they'll keep discounting it, but if you have a $1 million claim and you get a 60% discount, you still got a whole lot of money out there to spend.
Okay. Any other differences?
I mean, that's the big one right there is the floor of the cap. I mean, because the discount plans, they'll discount them, but that's important. I mean, getting a better price is always better than no price, and having a discount plan is better than having no insurance at all. But I go back to, if you have brain surgery and it costs $250,000, first of all, not everybody accepts a discount plan. A lot of places do. Not every place does. But on the big ones there, it's still a discount, and it might be a good discount, but you're still stuck with a lot of money.
Okay, excellent. And you spoke a little bit earlier in regards to some of the things that are in our healthcare plans that we can't even use at all. I think he was talking about, even males there's a part in there with maternity leave that we have to pay. Are there any things that are in our healthcare plans that maybe we're not using at all?
Well,
but we're paying for?
Well, yeah. Right now, we talk about the maternity that they all have that you may not use. Mental health is some people need it, and mental health is a serious thing, but not everybody, needs or uses it. The other thing that everybody has access to that most people don't use either is, most plans, every health insurance plan, Affordable Care Act plan, now has preventative care covered at no copay. So you can go for, an annual physical or a pap smear or a mammogram or a colonoscopy for that matter at no cost. I hate to use the word free because you're paying for it somewhere in the premium. But, there's a lot of preventive services that are there that people don't even think like, and I'm good. I haven't had a physical in several years, and, I could. It wouldn't cost me anything under the law, but, I don't go. It's just not my thing, but I probably should at some point.
Are you familiar with telemedicine?
Yes, big fan of telemedicine.
What do you know about it that we probably don't know?
Well, with telemedicine, a lot of companies offer that now as a free service. Sometimes it's a $20 a month service. But what telemedicine is, you can call, get a board certified physician on the phone, 24 hours a day, 365 days a year, and they can diagnose. I believe it's like 75% of the things they can diagnose over the phone, and they can even write a prescription for you. So if you call them, maybe you have bronchitis, they can give you the symptoms, they can diagnose that. They can call your pharmacy for you, have the prescription there waiting for you when you go there. And of course, that's even better because, then oftentimes it's a free service. So there's no copay, no nothing. You pick up your phone and call.
Okay. And I think I was reading an article recently, either yesterday or today, about with this repeal of these fines and penalties. It said that millions, I want to say it was like 7 million or something like that. 7 million people they were taking the fine anyway because it was less expensive
Right.
than actually having